From the America's Morning News Health Desk, I'm Dr. Tony O'Donnell. How bad is your osteoarthritis? Do you have rheumatoid arthritis? Kurt Hendricks is our special guest. Kurt is a chemist. He's a certified nutritionist. He's an expert in nutrition. Let me ask you this, Kurt. What is the primary cause of osteoarthritis and indeed rheumatoid arthritis? And what can be done to at least alleviate some of the symptoms and help patients reduce some of their pain and have a better quality of life?
For those people who have these conditions and have them chronically, a lot of them are just living on aspirin, acetaminophen, ibuprofen, naproxen, and the various symptoms of bleeding and ulcers and cardiovascular and kidney. The list goes on as to why not to take them when there are such natural anti-inflammatories and analgesics, pain relievers out there. But in addition to them doing all these other things that are certainly not healthy and dangerous, they also are known to interfere with bone healing, and that's 100% known by any of the physicians who have studied it and read the papers. So in addition to that, it's up in the air as to whether or not they actually interfere with the healing of the tissues for which they're relieving the pain. So this is not a good situation. I strongly suggest to those of you who are living on these things because you have this kind of chronic pain due to these type of arthritis or perhaps another type, is that you consider switching to 4 natural anti-inflammatory and pain relievers that are just proven effective for joint pain, but with none of the risks I just described. In fact, I take these ingredients every day because after decades and decades, and you know me, Tony, I'm a big guy, of just competitive sports, I did my knees in, and I was told that I might need knee replacement, and taking these, not only have I never needed knee replacement now, and that was 30 years ago that I was told that, I actually don't even have the daily pain, and I just take them as needed. Other people, perhaps who haven't been fortunate enough to know about these things that I was taking and have daily pain, might take them on a daily basis. The 4 ingredients are a form of ginger extract, a form of boswellia extract, which is a herb from Ayurvedic medicine, 2 sources of the herb feverfew, which is another anti-inflammatory herb, and 2 sources of magnesium. For the people who are listening who are thinking, geez, I would love to get off the aspirin, the acetaminophen, whatever, they can go to a page I created, which is called Now, N-O-W, 4, the number 4, joints, that's with an S, .com. It's now4joints.com, and they can actually read the clinical human trials that were done by hospitals all around the world that tell them how effective these things are. If they switch to them, it's just a win-win situation.
Wow, ginger, boswellia, feverview, never heard of that one before. I've heard of it, but didn't know it was effective for reducing pain and inflammation. And magnesium. What particular doses, Kurt?
Well, the ginger extract is anywhere from 500 to 1,000 milligrams a day. The boswellia, this specific one that I refer them to, is only 100 milligrams a day. Less potent ones can take 500 to 1,000. That's why I recommend this particular one. The feverfew are actually 2 sources. One is the whole plant, and the other one is an extract of the plant, so you get all of the chemicals that naturally occur in the plant that are anti-inflammatory. And then the magnesium actually helps certain pain receptors to deaden. It makes it less efficient for pain to be transmitted. Wow. So it's also very important in there.
You're fantastic. Now for the number 4joints.com. Remember to consult your doctor before implementing any changes recommended here on the Long Life Health Report, brought to you by longlife911.com. I'm Dr. Tony.